This presentation is about the process of aging, physically, that is. Why do we age in the first place? Well, is it a question of living too fast and too intensely? Or do our cells degrade and fall apart? Or is it programmed into our genetic code? Or all three? You have probably read commercials about losing weight, and one of the ways to do that is to try to rev up your metabolism. Is it a good thing to have a high metabolism? Well, not if you want to live a long time. If you want to live a long time, you should hibernate. Hibernating mammals live longer than other mammals. Or you should eat a lot less. In Okinawa, the people eat about 60% of the calories of what the Japanese eat, and they have more centenarians there than in Japan or in the rest of the world. Semi-starvation diets maybe will cause us to live longer. That is certainly what Aubrey de Grey, remember Aubrey? Looks how thin he looked? That's because he is on one of those semi-starvation diets in the hope of not getting old. Well, why are my cells falling apart in the first place? Well, there's this thing called the Hayflick limit, which is the total number of times that cells can divide before they fall apart. And it's about 20 times in the adult. And you know, the reason that they do fall apart is because the telomeres, these little things at the end of the chromosomes, these red things, get too small. And they get too small because after we are born, we no longer have the enzyme that creates the telomeres, which is called telomerase. Or our cells fall apart because they get messed up because of cross-linking of various proteins. Or they fall apart because free radicals penetrate their membranes and mess up the oxygen levels. And why are free radicals there? Well, probably because of ultraviolet rays, of pollution, of stress, all kinds of environmental reasons. Are we programmed to self-destruct? Yes, it seems so. But we don't really understand the program, but it appears that most likely our DNA is set up to self-destruct. Well, the next thing we're going to look at is appearance and mobility. Skin, hair, voice change, body build, age-related changes with the ability to move, etc. By the way, my voice is lower today. I have not suddenly aged. I am just coming out of the flu, and I might cough now and then. What is normal skin aging? Well, there is some skin thinning, there is less elasticity, there are wrinkles, there are age spots. And can we prevent that? Well, to some extent, you can do a lot of damage to your skin with excess sun exposure, especially tanning and all of that stuff. And you can become prematurely old as far as your skin. You can prevent a lot or slow down the skin aging by taking good care of yourself. Hair changes, however, are not so easy to change. The hair thins, it grays, and then you get hair when you don't want it. Like some women will get, some hair on their chin, and men will get some hair in their nose and in their ears. And voices change. They tend to get lower and not as steady because the larynx, the voice box, also changes. Our body build changes. We become shorter because the space between vertebrae narrows because of the force of gravity and because the collagen sort of flattens in between them. Our weight changes. We have a tendency to gain weight when our metabolism naturally slows around age 40 or so because we don't adjust our intake. And so you will gain weight for a certain amount of time. Weight will redistribute differently, like more around the middle often as you age. And then when you grow very old, then you tend to lose weight again. About mobility, muscle strength and endurance is really important for mobility. And the decay there is somewhat preventable. It depends on your level of activity. If you keep moving, if you keep exercising the muscles, you may not see very much change in muscle strength. With the bones, for the osteoporosis, which is a thinning of the bone, as you can see, it gets this kind of spongy sort of structure, very much more brittle and thin. Women are more susceptible to it than men are. The most important thing to prevent osteoporosis is to eat well when you are young, before menopause or before you are 40 or 50 years old. Eat when you are young, lots of broccoli, milk, and cheese, and good things like that. Also, what helps is weight-bearing exercise, and that really helps at all ages. Our joints do change. The wear and tear creates something called osteoarthritis, and I will show you pictures of what that is on the next slide. And rheumatoid arthritis, which is a disease, creates much worse changes than that. But that's a disease. You can have that when young. So you look at the joint. Here's the normal joint on the left. And you can see how nice that is, and the space between the two bones and how they're bound on the edges. And there is collagen there and some, synovial liquid there to keep things smooth. Then you can see the rheumatoid arthritis joint, how it is inflamed, it's got all this fluid, the bone is affected, it's really a mess, things get deformed. And then you see the osteoarthritis, where the collagen is worn out, and so the bone is bone against bone, and it hurts, and it flattens on the end, creates these bone spurs, and those are painful too. That comes and the cartilage is all eaten up. So that is caused by by wear and tear. And how does wear and tear occur? Well, it occurs when you exercise a lot those joints. You give them a lot of hard work. So athletes get it more than people who exercise more moderately. I'm not so sure that aerobic exercise is so wonderful because it also does these kinds of things. I think things like walking and moderate joint exercise are better than intense exercise that puts a lot of weight on your joints. Then we get into the sensory systems and the vision and hearing and touch and balance and taste and smell. Vision. Well, your eye changes. Beginning at age 40, your pupil, which is the center of your eyes, that dark part of your eyes, that opens in the dark and closes in the light, is slower to adapt. So that, for example, if you are old and you are driving a car at night and your pupils are wide open and then you get hit by the lights of an oncoming car, your pupil does not close fast enough so that you can get blinded. It's difficult to see. It's difficult to see for anybody in those circumstances, but it's worse if your pupil takes a longer time to adjust. And the lens also tends to get stiffer, which makes the accommodation not so good, so that people have difficulty reading, seeing small characters, and we call that presbyopia. And it tends to become more opaque, and so people tend to get cataracts. Now, you can get surgery for cataracts and replace the lens these days, so that's pretty wonderful. You can sort of prevent cataracts a little bit by avoiding bright sunlight and things of that sort, and not taking steroids, but they kind of come as a normal part of aging. Then there are disease-related difficulties, and those are the worst ones, like glaucoma, which is an increase of pressure in the eyes, or diabetes, which will often cause hemorrhages in the eye, or macular degeneration, which is the degeneration of the center of the retina, the place where you focus. And some of macular degeneration may sort of normally come with aging, but is very sensitive to environmental factors such as smoking. Your hearing changes as you grow older. There is a reduced sensitivity to high-pitched tones. So as you can see, the curves on the right show you how many decibels it takes, before you can hear. And you can see that at first it takes very few, and then at age 40 it takes more, and more at 50, and more at 60, and more at 70. And you can see that there is much variety among people. There are those that lose a lot more audition, a lot more hearing than others. You can prevent some of that, or slow it down, or make it less by being mindful of not exposing yourself to really loud noises, being very careful with those earbuds and earphones, because if you turn up the volume when you have put earbuds in, it's really bad. And it's particularly bad to do this while you're exercising. So listening to music while exercising, kind of loud music while exercising, while wearing earbuds, is a really bad idea, because you will cause